Well, speaking of healthcare, we need Medicare for all right now. We needed it 5 years ago. We needed it 10 years ago. Our healthcare system is an absolute disaster. Stop falling for the propaganda that America has the greatest healthcare system in the world. Yeah, we've got great doctors. We've got great advancements in science and technology that is so expensive that a lot of the hospitals and dentist office don't even use the technology, and they ship it overseas because, well, a lot of these places can't afford to use it, and people can't afford to pay for it. The leading nurses union has a brand new study out right now that highlights the need for Medicare for all, and it's a massive study that looks at the amount that hospitals are charging for basic services. So this is a study by the healthcare data nonprofit in the spring. They found that uninsured coronavirus patients, or those that receive care which were considered out of network by their insurer, faced costs ranging from $42,000 to $74,000 if they require inpatient treatment for coronavirus. Yeah, coronavirus causing people to go bankrupt because they don't have health care. So you want to fix something immediately? This is what we should be focused on, is our healthcare system and a Medicare for all program that takes care of the American people. One of the 100 of the most expensive hospitals in the United States charge between $1,200 and $1,800 for every $100 of their costs, which means they're marking up their costs for basic services and basic health care by 1,800%. 1,800% markup. So you want a Tylenol, like my wife, when she was giving birth with our son, wanted a Tylenol. And on her bill, it was a bill for, what was it, $350 for that Tylenol? One Tylenol was $350.
Well, and you know the saline that you get, the saline drip?
Yeah.
In the UK, I saw a thing where it was like $8 for a saline drip bag. It was $800 in the United States.
That's absurd. That's absolute corruption. $800 for a saline bag, $350 for a Tylenol. You know, this is why people they're like, I'm not going to go to the hospital and have my baby. I'm going to do it, and it's going to be in an unhealthy environment because I can't afford it. Even like if I have to pay the $1,200, $1,500 copay. My wife and I were talking about this yesterday. You know, the royal baby, the cost to have the baby was total for the royal baby was $1,800. Oh, $1,500. I'm sorry. I even inflated it. $1,500. 1,500 pounds. Stop randomly giving me numbers. 1,300 pounds.
Can I get 12? Can I get 12?
Can I get 12? Going once, going twice. So 1,300 pounds. That's how much to have the royal baby.
And how many pounds was the baby? So how many pounds was that per?
7 pounds, 3 ounces. My son, Miles, who's born in New York City, and we had to share a hospital room with somebody else. I think a woman who was like, what? Oh, she had a C-section. Yeah. And she was screaming the whole time. We paid it with the copay. It was like $1,800 just with the copay. And I had insurance. So the royal baby costs less than Miles to be born, which seems right. I mean, he's royalty, let's be honest. But and then the total hospital bill ends up being like over $30,000. And they jack these prices up because they know the insurance companies will pay for it. So when you have Joe Biden talking about tweaking Obamacare and talking about just really basically subsidizing the insurance companies, it's just a windfall for insurance companies. With Medicare for all, it would eliminate that. But of course, you've got a big insurance and big healthcare providers that want all of this money. These costs are killing people because they're not willing to pay for it, so they'd rather stay home than get the care and treatment that they need. Take a look at these numbers. So these are for the outpatient, inpatient Medicare, medical care from 1999 to 2018. I mean, just look at that. The rise in, overall hospitals across the United States charging an average of $417 for every $100 of their costs. And this average markup, if you look at these dates, has more than doubled over the past 2 decades. And these hospital profits have skyrocketed. These private hospitals and others, but 411% their profits are up.
Well, the thing is, if we were charged actual prices, like we could almost afford, even if we didn't have insurance, we could afford to go to the doctor.
Yeah, if we were charged like at cost.
I remember when I was a kid, we went to an Amish doctor in Indiana, and this guy charged $15 for a visit. So you could go in, get a checkup, get your thing, your physical or whatever, and it was like $15 to $20. That's in my lifetime.
Yeah.
That was in the 70s.
That's amazing. That's amazing. I remember growing up being able to go to the doctor for like a simple price, like at our local family doctor. It was not absurd like this. This is off the charts. While insurers often negotiate prices with hospitals, according to this report, uninsured patients have little recourse. Latinos are nearly 3 times as likely as black people, are nearly twice as likely to be uninsured than white Americans. The National Nurses Unit report found that findings further make the case for a Medicare for all system because Medicare is the most effective system to limit price gouging. And according to this report, it says the most viable solution to slowing the growth in hospital charges and the continued inflation of hospital prices is to bring all healthcare purchasers together under a public, nationwide, single-payer plan.
When you hear them arguing against Medicare for all, it's most likely that's, they're taking into consideration, yeah, okay, if you consider to charge the government the prices that they're currently paying, sure, it wouldn't work. But if you would like charge actual prices, Medicare would save. Just imagine how much money it would actually save versus continuing on with this system where it's just price gouging.
Well, the politicians aren't behind it. You have a few progressive politicians that want it, that want Medicare for all. Bernie Sanders has been calling for it. Out of control hospital bills, out of control Medicare medical costs, prescription drug prices, where like almost all of your money from your take-home pay has to go for medicines. Trump doesn't want it. Biden doesn't want the single-payer system. I think we need to be careful about a single-payer system, to be honest with you. But I think a Medicare for all structure is right. Their hospitals are arguing that they're going to lose money under Medicare. Oh, really? Well, 411% increase in your profits? So you're making money off of people who are hurt and injured or need health care or are hurting? This should not be something where, like in other countries, you just don't see these like ads for all of these different pharmaceuticals. Why do I need to watch a 30-second ad for this, this like heart medication? Why would I need to see why? And then I have to listen to 10 seconds of disclaimers. May cause diarrhea, may cause blah, 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 blah. Like, that doesn't happen in other countries. You should ask yourself, something is totally wrong with our system when we're having to just watch afternoon television, Watch your soap operas in the afternoon.
Well, and that's why when there's
drug commercials.
When there's a huge percentage of the population that wants something like Medicare for all and this other stuff, you just have to look at like who would lose, like not benefit from that happening, and that's who they're in the pocket for. Like the drug industry, they don't want that. The insurance industry doesn't want that. You look at free education, the colleges don't want that. You look at they feel like they're gonna lose money, so they lobby Congress and pay them because they know that's worth it. Like it's better for them to pay millions of dollars to these senators and congressmen to get these bills to pass or not to pass, rather, so that they don't lose their paychecks. That's all it's about.
And it's about paying these administrators. It's about it's about artificially inflating the cost of things so that these people are making money hand over fist. I think the one of the pieces in this report, it talks about Canada. Americans spend twice as much per person as Canadians on healthcare. But instead of buying better care, the extra spending that the U.S. spends is on profits and useless paperwork. That means 34% of the healthcare expenditures go towards administrative costs in the United States, just paperwork. Because we have an antiquated electronic system, by the way. In other countries in Europe, you've got your health ID number, and everything electronically is tied to that health ID number. And you know your health ID number, like by heart. It's like your social security number. And everything you get in your life is tied in a database You got vaccines when you were this age. You got the, you had chicken pox when you were 9. You went to this hospital visit to get your ears checked when you were 12. It's all there. But in America, we don't have that. And so if you want to transfer or move a doctor, they've got to fax over and get them to write a permission slip for you to get your old doctor's records, which, are on paper. So no wonder we're paying twice as much, and almost all of that money goes to paperwork and administrative costs. It's not going to healthcare. It's going to the overhead of healthcare. If we would just eliminate that 34%, we could save, thousands of dollars for patients.
Well, in drug prices, Amanda Hamilton said her son has cystic fibrosis and one of his medications is $31,000 a month.
Oh my God. What? Jeez.
And they probably know that because they probably know that's what's sustaining his life. So it's like, well, if it's a life-sustaining drug, look at what we can charge for it.
Right. Right. And what about a system that actually rewards preventative health? Wouldn't that be a novel idea? So no, we're not rewarding those that make money off of the treatments. What if we could we avoid it altogether, where you never have to go get treatments? Obamacare, of course, is what President-elect Biden wants to expand. He wants to call it Biden Care, as he said. But some of the modeling shows that the administrative costs under an expanded Obamacare would actually go up, costing us more money. Of course, the rap against Obamacare to begin with is that it costs more money, that it's more expensive. People's health care has gone up. Why? Because of all the extra paperwork, administrative costs. Without the savings to overhead, without the pharmaceutical costs, without the hospital and clinical fees, all the fraud detection, Medicare for all, for those who want it, could annually cost $175 billion. That's over $600 billion more than Medicare for all. That costs more than a Medicare for all program. By doing all of those things, without the savings to the overhead, without the pharmaceutical costs, without the hospital and clinical fees, and fraud detection, the Medicare for all who want it could cost $175 billion more than what we currently have. And that's over $600 billion more than Medicare for all would cost. And for those who say we can't afford it, like even Biden says we can't afford a Medicare for all program. Even Trump says we can't afford a Medicare for all program. And yet, again, we can spend $750 billion a year on defense budgets.
What they really mean to say is Wall Street can't afford Medicare for all.
Mm-hmm. Right. We can't hurt Moderna. We can't hurt Pfizer. We can't hurt these. We can't expect them to take less profit, can we? These for-profit hospitals that are doing just fine.
Well, unfortunately, the Medicare system is actually pretty solid, like it's pretty efficient. So it's already in place.
Yeah, it's very efficient. There's critics, of course, that say that if we switch to the single payer system, that doctors are going to get out of the business. We've been hearing this for years.
You mean like greedy doctors might get out of the business and people would get into the field that actually care about people? That's what you would end up with?
Right. Or, you've seen over the past number of years, so many doctors who just decide not to become surgeons, et cetera, because of malpractice, lawsuits, et cetera, that they, want to become plastic surgeons. They want to just do breast implants. That's what their focus is, less malpractice. They don't have to deal with it as much. More lucrative. This study, Federal Reserve survey published last year, found that 25% of American adults skipped necessary medical care in 2018 because they were unable to afford the costs. Another found that 26% of Americans with diabetes have rationed their insulin because of the cost. That should not be happening.
I'm just floored by some of the costs.
This massive report.
I was going to say really quick, some of the costs that people are saying they're paying for medication and hospital bills and stuff in the chat is astronomical. It's just unbelievable.
Tell me, what are people saying here?
Kitty Jones.
Drop me a line. I want to hear your comments. Kitty Jones.
Kitty Jones said she takes Gleevec.
Gleevec.
Go ahead.
Oh yeah, for leukemia, the cost is $150,000 a month, according to the statement. I had to get a pass not to pay that. Holy cow! $150,000 a month.
Like, what is in a drug? Like, what rare metal or something is in a drug to justify $150,000? It doesn't even cost that to process anything.
Well, you remember Martin Shkreli, of course, the pharma bro, right? And that's, I mean, it's not often I'll call somebody a scumbag, but that guy, an absolute scumbag who, knew what he was doing, smirking the entire time through his trial, running up massively drug prices, price gouging. And again, you wouldn't have this under a Medicare for All plan. It's just awful.
Well, and it's literally, if you look at the drugs that they're charging the most for, it's the life-sustaining drugs that they know people are not going to let someone die. They're going to pay it. Like it's like coercion.
Yeah. Yeah, what are you going to do? Just die? I can't take my leukemia medicine. I'm going to mortgage my house to live? Again, greatest country in the world. Greatest country in the world. The other day, Vice President-elect or President-elect Biden tweeted, "America is back." Back where? What does that mean? Back. We're back.
Yeah, where did we even go?
Right. We're back. We're back to this crap. I see someone saying here, Shelley Pelt says insulin for a diabetic costs over $1,000 a month. Becky Medved says, I pay $300 a month for 3 medicines. I mean, think about that. That's rent. My rule of thumb, and the rule of thumb I think of a lot of people that are in the finance space, basically say you shouldn't be spending more than 25% of your take-home pay on a mortgage payment. How much are you supposed to be spending on medicine per month? America is sad. And all the people Brandy says, just think of all of us who lost our health care during the pandemic. And Brandy, you lost your health care? Sherry Kraft says 3 of my inhalers are up in the thousands of dollars. The rest of my meds are off the charts. I'm trying to pay for oxygen right now.
Jeez.
Lisa Hill says I have TBI and suffer from things attributed to a car accident. I have meds that start out at $15,000 down to $300 per month. $15,000.
You want to know why there's overwhelming support for Medicare for All? You're hearing it right now.
Right here. I have like chills thinking about this. And you think about these politicians that didn't want to run on this, didn't have the balls to talk about it. Who would be against it? Except the corporatists in Wall Street, the corporate greed, those who are against it. Those are the people that keep the Mitch McConnells in place, the Nancy Pelosi's in place. They funnel millions of dollars to their campaigns, and they keep them from ever trying to bring something like this to the floor. Instead, we've got this hodgepodge Obamacare, which is basically just subsidies for insurance companies, driving up the cost of things.
Well, the thing is also, you see people a lot of times saying, well, good old capitalism. But the thing is, this is a bastardized capitalism. This is crony capitalism. This isn't true capitalism.
Yeah. But don't you think though, at some point we gotta wash our hands of this system.
Oh yeah. It's definitely broken.
We talk about this being like a failed state or this is broken. When people say, well, where do you want to go? Socialism? No, that's not what I'm saying. But if you want to look at like Norway, you want to look at other countries that are market-based economies, people go to work, people pay higher taxes, but you don't have this crap. You have a much higher standard of living. You don't have people left behind. You don't have people. I mean, look, people don't, I mean, there's like hardly any, there's like zero crime. You have some of the best healthcare in the world. You have some of the best education systems in the world. People don't leave Norway. Do you ever hear of people like, there's like a mass exodus of people leaving Norway or Denmark? Like they just got to get out of there. It's just terrible over there. No. Because people love living there and they're well taken care of and they have the highest standard of living in the world. Why? They don't have this capitalist structure. They have a market-based economy. It's not socialist. But guess what? People are taken care of. And if we're the greatest country in the world and we have a craptastic healthcare system like we do, it's an embarrassment. Then, we need to make a change. And don't tell me that we can't afford it. If we're the richest country in the world, we have the biggest economy in the world, and we can buy bombers left and right and build aircraft and drones left and right.
Well, have you ever seen Sicko with Michael Moore? I know we talked about a couple of his documentaries before, but like where he breaks down, when you look at those countries paying like 75% tax, but then you look at everything that we pay for in the United States, it ends up being more than that, and why we have no savings. And so it's crazy that people look at that as something that's wrong. When you look at the quality of life that they get, I would pay whatever I had to pay because you don't have to worry about medical. You don't, you got enough money for food. You got enough money for your housing. You got everything you need. And when you don't have to worry about anything like that, like your medical bills, I mean, think about how many people right now are worried because you're not getting a stimulus. You're not, you might not be having a Thanksgiving dinner. You can't afford your medical bills. Like those concerns are gone in those countries.
Yeah, it's a great point. And I think also when you think about, to your point, like sort of, preventative medicine as well, like it's the whole system. The whole system is broken, from kids' school lunches. So kids are getting this like, awful processed food school lunches and wonder why we're one of the fattest countries in the world. And we have to deal with diabetes off the charts. Well, what if we had a system that actually provided very healthy school lunches? Like they do in Europe, like literally serving quinoa salad for lunch with a pumpkin soup, fish, roasted chicken, and not processed, fresh. And then you don't have like an entire nation of people that are morbidly obese having to rely on these expensive medicines. It's just this, they're making money off of this misery. And it's that's what they're being rewarded for. Keeping us sick, keeping us overweight, keeping us unhealthy.
Did you ever see that cartoon that somebody drew that said weapons of mass destruction, and it was this plane dropping knives and forks over the United States?
Right. Yeah. Sad but true. Maria Davis says, I feel bad for all Americans without health care and for paying for outrageous costs. Socialized health care works. As a veteran, I never have to pay for health care. I get great preventative care and treatment. There you go. Karen McNabb says, for all of my medicine from January to October is over $22,000. This is ridiculous. For 3 months of my Ozempic, I don't know that, but is $2,500. For 3 months, it cost her $2,500. Jeez. I remember my grandmother, in the 80s, paying a ton for her medicines all the time.
That's why you see so many people that just they die penniless, because when they retire, you're not getting enough from Social Security and you still have the cost of these drugs, and it's just, it's one of those things. It's like education. It's one of those things that just makes me absolutely sick to think about, that people actually suffer in the richest country in the world. There should be no homeless. There should be no hunger in this country.
Mm-hmm. No, it's so unbelievable to me, and it's so disturbing. So this is the kind of story, these are the kinds of stories we need to be covering and pushing our politicians on. These are the kinds of things that we need to push, President Biden on, his administration, and not continue more of the same. Someone said, there was a Oh, that was what I wanted to say. Someone said, I remember someone was watching Fox. There was a town hall with Bernie Sanders. I missed that. It scooted by. I forget who wrote it. I'm sorry. I'm just doing it from memory. So if this was your comment, I apologize. But someone says, I remember watching the Fox News town hall with Bernie Sanders. It was a room full of Republicans, and Bernie Sanders said he's for Medicare for all. And Brett Baer for Fox asked the entire audience, who here is in favor of Medicare for all? And everyone stood up and applauded. A room full of Republicans.